How far are we from hepatitis C elimination in Europe?
Despite excellent diagnostic and treatment tools, Europe is still not on track to eliminate hepatitis C. The problem is that so far, only a quarter of infected have been diagnosed and only a third of those have so far received treatment. So these figures definitely need to increase urgently. However, the countries throughout Europe are not employing the full remit of planning, of evidence tools, and of strategies. And in fact, inequity is the core barrier to the progress of eliminating hepatitis C. Because the poorest access to HCV testing and treatment services often have those who are marginalized, vulnerable, or underserved, and actually face the highest rates of hepatitis C virus infection. And for example, these are people who inject drugs. So it's quite clear that Europe will not achieve the elimination targets for hepatitis C virus without placing the needs of the key populations in the center of the epidemic response.
How are drug use and hepatitis C issues related?
In Europe, people who inject drugs are the driving force of hepatitis C virus epidemic, and they account for the majority of new infected cases. Among estimated 2 million of hepatitis C virus infected people who inject drugs, the prevalence of infection varies across European countries. However, 3/4 of HCV infected drug users come from the Eastern European countries. In the last decade, the mortality due to untreated HCV infection has been particularly increasing in people who inject drugs, who most commonly present very late in the course of the hepatitis C. But the projections suggest that by broadening the accessibility to treatment of people who inject drugs, this would have prevented the considerable proportion of new HCV infections throughout Europe.
What are some promising approaches?
Well, inequalities definitely must be confronted and addressed instantly. And the magic bullet here is a patient-centered approach, which is based on simplification and decentralization of hepatitis care. The European Association for the Study of the Liver recommends simplified treatment regimens for people who inject drugs, but EASL also urges European countries to implement harm reduction strategies and to provide them with rapid testing and accessible treatment. Besides, EASL strongly recommends that all barriers need to be removed by combating stigma and discrimination, and also by changing policies that hinder access to hepatitis C care. And such policies include also decriminalization of minor non-violent drug offenses. And a very good example of such a decriminalization comes from Portugal, where it has already yielded some very promising results.
What lessons can we learn from Portugal's success story?
In regards to drug abuse, Portugal was the first country in the world to decriminalize minor drug offenses and to decriminalize the public and private use, acquisition, and possession of all drugs. This was 22 years ago, and this led to a clear paradigm shift in regards to focus on the public health issues rather than on the public order priorities. So this led to a solution where there was a differentiation between the user and the issues that led to the usage of drugs and the dealing of drugs. So the need for harm reduction responses was systematically assessed, and activities such as and programs such as counseling or wide reach or target reach, needle and syringe exchange programs were scaled up accordingly. This led to two important outcomes. First, in the last 20 years, the European Monitoring Center for Drugs and Drug Addiction reports that the number of the incidence, meaning the number of new cases of hepatitis B and C, have fallen consistently in the last 20 years. And it also led to a major decrease in drug usage. So this is for sure one of the most success histories in the public health history of Portugal, and one that should be replicated worldwide, focusing on the issue of drug usage on the public health problem rather than on the public order problem.
How can your work at the European Parliament contribute to eliminating hepatitis?
There's several ways where we can target hepatitis elimination. The EU Cancer Plan highlights the need to tackle hepatitis B and C that can prevent liver cancer and hepatic cancer. Of course, there's on the provision of healthcare, which is a member state competence. Each member state can take actions to increase, for instance, hepatitis B coverage, and also enhance accessibility to hepatitis C treatment. And before reaching the treatment, we need to target prevention, so avoiding that people contract the virus. And after contracting the virus, if that happens, it's very important to have early diagnosis. So at the EU level, we have different mechanisms that can fund programs and projects related to hepatitis elimination, such as the EU for Health program. But it's important to highlight that we must not target elimination of hepatitis as a wholesome problem, and we need to see who are those mostly vulnerable, because many Europeans that are infected with hepatitis B and C are part of vulnerable populations and are still going undiagnosed. For this regard, the ECDC, which is the European Centre for Disease Prevention and Control, can play a major part in monitoring the issue, and it's important to close the gap between each member state at the EU level in regards to inequalities when it comes to hepatitis elimination. We have treatment available, we have vaccines available, we have diagnosis available, and it's a matter for us to work together to improve accessibility to all these measures in order to clearly eliminate hepatitis in the European Union.